I nominated Dr. Jill Hood because last December I requested Dr. Hood to coach one of our trainees for the exam. I had never met Dr. Jill Hood before I wrote to her. I only heard from other educators in Sheffield that she's really able to change the mindset of the candidates. I knew that that's what one of our struggling trainees needed. So she's just transformed an angry, frustrated, struggling trainee into a positive, grateful trainee, being so inclusive. I was so impressed. Someone who she's never met, she's willing to help. The moment I saw the word inclusive, I thought of her, and so I nominated her.
Dr. Jill Hood, she's looked after the trainees in a pastoral role and educational role for the last 30 years of her career, helping trainees develop, ensure that they get through their exams, which are particularly difficult for anaesthetics. Jill is due to retire early next year, and myself and other trainees wish to say thank you for all the hard work, extra hours, time, patience, support that you've put into getting us where we need to be. A lot of us wouldn't be here without you.
I'm trying to encourage local businesses to support people with disabilities into employment. I'm working very closely with a range of partners, including MENCAP, Job Centre Plus, East Riding Council, and we, as a CCG, have been supporting in those plans with events, but also locally with offering up opportunities for people to experience the work that we do. More recently, there's been the Disability event to encourage businesses to take part in an innovative session where we actually outlined what the benefits were for employing people with disabilities, including the health benefits. For some employers, it's that unknown that they're going into that makes it more difficult for them. And what we're trying to do through Disability is to provide them with the information and the support to make it an easy transition for them to employ somebody with a disability. Being inclusive for me is creating that culture of openness, transparency, but I think we learn things from each other, we learn from each other's experiences, and it's good to have difference in an organisation. We can't all be the same, and I think we need to experience other people's cultures and differences.
But we do a lot of work with lots of different patient organisations and voluntary sector organisations to make sure that patients' voices are heard. What's their experience of care? What are their ideas for improving the way that we can design our services? But also what's working well that we need to keep and we need to do more of. Myself and some colleagues lead the NHS Youth Forum. We've got 25 young people from all over the country who come together to form a core part of the Youth Forum, and they're connected through social media to a really wide range of other young people. So we've got thousands of young people then who can really help inform us in the way that we work. We know that we're not really very good at listening to their voices, and quite often they get missed out. So the Youth Forum gives us a real opportunity to consult with, to engage with loads of children and young people across the country nationally. So it's our job now to make sure that their message gets out. I think it's incredibly important to be inclusive because it's really important to hear the voices of those service users that are the most vulnerable and perhaps have the poorest health outcomes in society, because if we're not listening to them, we're not delivering a really good service. I know that when I felt inspired, it's because I've had a say in the programme and I felt valued, and I try really hard to do that with the work that we do in our team, because we've probably all got ambitions about how we want to see our healthcare services in 2020, and if we're talking to the public about that now, we've got a better chance of getting there.